Welcome then to the opioid PPW program. We're going to focus on the 2021 new version, latest version of this program for adolescents. Again, we have two other versions: high risk young men, high risk young women. So I'll walk you through this program, the manual, the PowerPoint slides, the online resources, and everyone who's registered, I'll send them a link to this recorded session in case you wanted to share with others in your region, state, or nation. You're welcome to do that. The more, the better. Trying to get the word out on these magnificent, unique programs that we offer here at Prevention Plus Wellness. Our programs are very efficient. Most of them a single session screening and brief intervention. Screening brief interventions are some of the most effective known physical and mental health interventions that we know based on research, evidence-based. In fact, screening brief interventions is considered an evidence-based practice across many different organizations: SAMHSA, NIDA, CDC, NIAAA, American Academy of Pediatrics, etc. So this single session program will walk you through it today. And again, at the end of today, we're going to have time for Q&A. So if you have questions anytime as we go along, find your chat on your toolbar. It's mine is under the More heading with 3 horizontal dots. Point your cursor at that, you'll find chat. And then you could ask any question or make any comments you want that's appropriate to this group of prevention and health specialists from across the country. We may even have some people abroad. We're going to find out about that in just a moment. So this is your period. Let me know what you need, what you want. If you want to bring something up that's relevant, you think, to the rest of the group, feel free to do that, and do that in the chat option. And as you have questions, type them in, and then we'll address them at the end of the content portion of this session. So don't wait to the end. If you have questions, if you have comments, if something's not clear, you don't understand something, if there's something that you're struggling with in your region, your prevention specialist, feel free to share it here. If you have something that's really working well, you want to share with your colleagues, go ahead. This is a great platform to communicate, not just from me to you, but among yourselves. Okay, so what we'll do to start out with is I have a poll, a brief poll. I'm going to launch that. It's 4 very brief questions. Please do, all of you, participate if you are online and have that option to do that. Participate in the poll. We'll look at the responses. That'll help get a sense of who's online today. And then after that, we'll launch the content, and then we'll open it up for Q&A. Again, don't hesitate to ask any questions you might have under the Q&A or the chat option anytime during this. And we'll take those questions in the order that they're typed in. So let's take a look at the poll, first of all. Let me launch the poll. Again, this will take just a moment to get to you 4 very quick questions. Some of these are multiple choice. You can answer more than one. The first one is, where do you live? Of course, that's going to be a single response for that item. Question number 2, what type of organization or agency do you work for? That's multiple choice. Excuse me. So you can answer more than one item there for number 2, your organization, agency. Number 3, and you're going to need to scroll down to see all 4 of these questions, I think. Question 3, which prevention and health topics are you most interested in? That's multiple choice, so feel free to answer more than one there. And then lastly, what types of resources are you most interested in? Prevention and wellness resources. What is it that you're looking for? Let me know what you are interested in here. So let's just take a couple of minutes to give you a chance to answer this. Not too long, because we don't want to take too much time on this, but we'd love to have at least the majority of you respond to these 4 very quick questions before we take a look at your answers. So just another 30 seconds or so. We're already up to over 60% was, well, we had 60%, 6 and 10 of you had answered or thereabouts. So it'd be nice if we had about 7 to 8 out of 10 of you respond before we shut down this polling. Another 15 seconds. So last chance, everyone. Make sure you answer this if you can, so that we can see where you're from, what your interests are, what your needs are, and just another 10 seconds or so. So if you haven't answered, now is the last chance to do it. We're up to 65% of you have responded. That's awesome. It'd be nice to get that up to 70%. Let's see if we can get it up to 70%. We just need to have one or two more of you respond to these items, and then we'll reach that goal. All right, 67%, 69%, almost there. One more person will do it. Who is that person going to be that's going to push us over 70%? Last chance, counting down. And all right, I think we'll go ahead and close it at this point. Thank you all who participated. The majority of you have done that. So let me end the polling. Oh, over 70%. Thank you, guys. And I'm going to share the results with you right now. They may take just a moment to reach you. Most of you who are participating today are in the South. Down here by us, here, beautiful St. Augustine, Florida, maybe. That's where Prevention Plus Wellness is located. And I'm sorry, I forgot to introduce myself, Dr. Wirch, Chudley Wirch at Prevention Plus Wellness, the developer of all PPW programs. But we have people in Northeast, Southeast, Midwest, South. We even have some people outside of the US, which is awesome. Welcome all of you. And thank you for taking time to visit us today and spend time with us. Question 2, what type of organization are you with? The majority of you prevention, that makes sense. But a little bit of everything, a little bit of all the other schools and governments, substance use treatment recovery coalitions, tribal nations, and others. I don't know what the others are. I'd like to know what that is. So if you want to share that in the chat, go ahead. Let us know what organization you're from that isn't listed here. I'd like to know that. Question 3, what prevention health topics most interested to you? Alcohol is the number one. Of course, from a youth perspective and even from an adult perspective, that's the number one cause of injury, harm, and premature mortality in the United States and abroad, alcohol. But you also very much interested in opioids, makes sense because that's what we're focusing on today, as well as e-cigarettes and marijuana, wellness promotion, mental health, and even some other topics. And lastly, what types of resources are you interested in? Almost all of you evidence-based programs. Now, and then after that, online training, I'm assuming in these programs, but also quite a few of you mentioned online materials and media campaigns, online materials and media campaigns. So that's a little bit vague, that area. So I'd love to hear from all of you right now for this question here, number 4. What is it that you're really focusing on? What's your really interest? If it's evidence-based programs, fine. Online training, good. Online materials, media campaigns, all 4 of them are a little bit vague. So take a moment, if you would. I'm going to shut this polling down right now. Let's see. I'm going to close this. Close the polling down. Take a moment. Find your chat option. And then just give me some ideas right now. What is it that you're really interested in within those areas? What kind of programs? What kind of training? What are the online resources you're really interested in? And what kind of media campaigns are we talking about? Let's take a quick look at that as you're responding right now. I'd be very interested in knowing a little bit more about your interest in this area. So I'm going to go back and see, we've got Health Department, Maryland. These are some people typing in where they were from at first. That's what Linda did. But then Barbara said evidence-based programs. Okay. Any particular kind. And we've got some prevention and wellness, messaging for youth, adults, separate content. Very good. Thank you. Any other specific kinds? What is it that you're interested in, particularly in the area of online resources and media campaigns? By the way, a media campaign could be online resources. So again, those are a little, and unfortunately, the polling doesn't allow you to type in responses. So that's why I'm asking a little bit more. So again, media campaigns, yes, here we go. Let's see here. I'm going to go back, make sure I didn't miss anything. We've got, I'm new to youth empowerment and would love to have more information on media campaigns targeted to middle and high schoolers. Okay, thanks for that, Melissa. Media campaigns, very good. What kind of media campaigns? What are we talking about? What is it that you're interested in? ATOD and wellness pamphlets and brochures for youth, for parents, for school staff. That's very, very concrete, specific. Thanks for that, Veronica. That makes me understand a little bit more about what your needs are. You'd like these tools, these materials, pamphlets, brochures, youth, parents, school. Let's see if there's something else. Evidence-based programs that we can use as an education piece in schools. Thanks for that, Linda. Targeted around ATOD, okay, alcohol, tobacco, other drug use. Any new ideas on prevention for youth to get the focus on prevention that teens will better relate to? That's a fantastic idea. Jennifer, interest there. All right, so if you have some other ideas in terms of what it is that you need, that you want, particularly in the area of online resources or campaigns or evidence-based programs and training, go ahead, feel free to type that in to your chat and we'll take a look at that toward the end. Right now, let's go ahead and jump into the opioid PPW program. What you're looking at here is a picture of the front copy of the adolescent version. The new 2021 version, you'll see that gold band across the title there, opioid use disorder prevention program promoting a wellness lifestyle. Remember, again, we've got two other versions of this program, one for high-risk young adults, one for high-risk young women. But this is the 2021 version, the updated version. The table of contents, you can see it here. There's 7 sections: introduction, step-by-step directions. Now, in addition to the step-by-step directions, we offer a 2-hour live program implementer training, which we highly recommend, so that you can really get a full overview of the program, how to best implement it, do you need to tailor it, how you can evaluate it, and on and on. So that is very, very important. And we have that separate than the program manual because not everybody wants the training, but really in our experience, the training becomes very, very essential. So along with this program manual, this is a physical manual. This is what you're looking at, the physical manual. This is a Word document. You'll actually get a hard copy of this. And you'll also receive, along with this physical manual, and that's the case with most of Prevention Plus Wellness programs, you'll also get a digital download. So you copy that to your favorite device for safekeeping. It includes your PowerPoint slides for implementing your program and all of your reproducible materials to implement your program to countless young people. So it's a one purchase situation. The more you implement it, the less expensive it becomes per youth. So it becomes very, very cost effective. You don't have to buy extra materials for the teacher, for the students, etc. It's all right there in your manual and in your digital download. So I think it's a very good way to go, and that's what most of our prevention providers. These programs, PPW programs, are being implemented incidentally across all 50 states in the nation, and abroad. So because they're very brief, most of them just a single session, very practical, very much likely to achieve a full public health reach. In other words, almost all youth or young adults can be reached with these very brief and powerful programs. And yeah, like somebody just said in the chat space, because they focus on positive behaviors and positive images, that is different types of physical activity, healthy nutrition, sleep, stress control, they're very, very much they're sorry, I had a problem speaking. They're very much of interest to young people and to parents, to communities, to organizations, funding agencies, and so on. So, what else was I going to say? So that's section 2, step-by-step directions, but we also have the online 2-hour implementation training. And by the way, we have a 2-hour online trainer. So you can train other professionals in your region to implement this program if you'd like. Section 3, screening and a goal plan / contract. So all PPW programs are evidence-based screening and brief interventions. They include 3 components: screen youth for their current health habits, increase their awareness of their healthy behaviors, substance use, but also protective wellness behaviors. 2, feedback on those behaviors. Follow your script in your manual. It's all scripted, very easy to follow. Show your PowerPoint slides for the visual learner. That content is positive image communication designed to elicit desired future images of youth, of themselves in the future, being more fit, active, healthy, successful. Very, very much motivational type of content that increases motivation for them to choose. They see desired images of themselves as values. If they're values, they're likely to want to change those behaviors. And then step 3 is the action piece. First 2 steps are motivational. Second step, action. First step, screening and feedback. Second part, action, goal setting. That's where you help young people set goals to move themselves forward in improving their lifestyles, not just avoiding substance use, but also, because PPW programs are integrated, also to improve protective wellness behaviors. So that's why you have a screening and a goal plan. And those are also in your digital download. So you can make as many copies of those so you can implement this to dozens or hundreds or thousands of young people if you want over time. Section 4 is your individual feedback lesson script. That's if you implement this opioid PPW program to 1 youth at a time, in person or online. And section 5 is the group feedback script if you implement it to 2 or more youth in person or online. So, and we have our protocols all set up so that it can be implemented as easily online as it can be in person. So it works great for the pandemic, or if you want to reach out to youth beyond your immediate physical space. So that's your script. You have your script. You open up the script to glance at your script. You've practiced it already, hopefully. So you glance at it, you look up at your youth through your camera in this case, and you present your content to your youth. Lots of enthusiasm, a lot of passion, and you walk them through screening, feedback, and goal setting. 6, you have built-in evaluation tools. I'll show you those in just a little bit. Even a pre and a post test, so that you, as a prevention or health specialist, can evaluate how your program worked for your youth. So it's very, very focused, and you'll get the feedback that you need to promote your program and to improve your program over time. That's an evaluation material, section 6. Lastly, we've got a brand new tool. It's a follow-up goal plan. If you have access to the youth, if you can even give them an assignment to continue the action phase, that goal setting research shows very, very important to behavior change. Now you start to get a sense that this is a little different than other evidence-based and evidence-informed programs. It's focused on behavior change. It's focused on really making sure young people move toward avoiding or continuing to avoid, in some cases, substance use, in this case, opioids and other substances, and increase protective wellness behaviors, which can keep opioid and other drug use less likely to happen in their lives. If they're getting exercise, if they're sleeping, if they're controlling their stress, all these things very, very important to protecting their overall health, mental and physical health. Okay, so let's go ahead and take a look at the contents. Okay, by the way, let me stop at this point. If you have a question, if you have anything that doesn't sound clear at this point, you have the tools to ask that. Just go to your chat option or your Q&A option and type it in. And then at the end of today's session, I'll take a look at it and answer the best I can. So if anything doesn't sound make sense to you, or I'm not clear about something, let me know. And you could do that right now. So there's your introduction in your manual. There's your step-by-step directions to implement your program. Here's your screening survey and goal plan. Let's take a look at the screening survey in the opioid PPW program for adolescents. So again, the purpose of this survey, of all PPW programs, of all screening, of all PPW program screening and brief interventions, is to get you to become more aware of their current health habits. So let's take a look of what they include in the opioid PPW program. Question 1, most days a week do you engage in moderate physical activity, at least 30 minutes, such as you can see it, fast walking, slow biking, skating, etc. The answer yes or no. So it just takes, how many questions are there? There's only 6. Very quick. Takes a couple minutes to implement this. Question 2 is about most days a week do you engage in vigorous exercise, at least 20 minutes. Makes you sweat and breathe hard, such as basketball, soccer, running, swimming. So 2 types of physical activity are mentioned here. According to Centers for Disease Control and Prevention and other fitness and health organizations, young people need 60 minutes of physical activity every day a week, minimum. And we know from the Youth Risk Behavior Survey, most youth are not getting the required amount of physical activity. So youth need a combination of moderate and vigorous aerobic physical activity, as well as some muscle/bone strengthening physical activity. Question 3 of the screening survey for your opioid PPW program, does your everyday diet consist of mostly nutrient-dense food? So this is a great opportunity for youth to learn about what does it mean, nutrient-dense foods, foods that have a lot of vitamins and minerals in them, and there's some areas or some categories and some examples: whole grain bread, cereals, pasta, lean fish, poultry, lean meat, dark green and red vegetables, citrus, and other fruits. Yes or no? Question 4. So that's, by the way, a nutrition question. Youth Risk Behavior Survey shows most youth are not eating a breakfast every day of the week, and almost less than 20% are having 1 fruit and vegetable a day. So great opportunity, great needs to improve the nutritional patterns of young people. That's question 3. Question 4, you usually get 8 or more hours of sleep. Sleep is core health behavior. Youth Risk Behavior Survey shows most high school students throughout the nation not getting 8 or more hours of sleep. Some need 9 hours, some need 10 hours. Really an important behavior that young people are actually suffering from a lack of. Question 5, most days a week do you use stress control techniques such as relaxing in nature, progressive muscle relaxation, meditation, tai chi, yoga, deep breathing, regular exercise, physical activity? All those very good for helping a person deal with daily stress. Yes or no is the answer. And again, great opportunity to educate a little bit more about this wellness area for young people, which is so lacking and which is associated, uncontrolled stress is oftentimes a core reason identified for using substances, including opioids. Lastly, question 6, here's the substance use question. This is the opioid PPW program, so it's about that. Past 30 days, have you used any prescription opioids, for example, Oxycontin, Vitamin, codeine, or morphine, for non-medical reasons, or use any illegal opioids like heroin or fentanyl? Yes or no? Of course, our other PPW programs address other substances. The marijuana PPW program, that measure will be about marijuana. Vaping PPW will be about e-cigarettes. And our evidence-based sport for youth and in-shape PPW programs for young adults deal largely with alcohol. So there's your screening survey. You got a sense of what the screening survey questions are about. The goal plan is the last part of the intervention, so we'll skip past that. Here's your individual script. Let's say let's go with the group script first. I think a little bit easier. Let's look at the group script first, so to see what it looks like. Now, again, PPW programs are scripted. That means that as far as advantages go, that it doesn't matter who's implementing this program or when they're implementing it. If they follow the script, it's going to ensure fidelity and reliability of that program across implementer, across time. So that's a very big plus for implementation and prevention, or any kind of mental health program, treatment, etc. So scripting reduces the amount of time to be trained, and because it's scripted, almost anybody can implement these programs. We've even trained youth to implement them to their peers. So here's the group script. Let's take a look at it. So what you do with a PPW program like this Opioid Prevention Plus Wellness program, you practice your script. Ideally, you got your 2-hour online training. You practice your script. You're ready to implement it in person or online. So this is the group script. This is where you will provide this lesson to 2 or more youth in person or online. Notice there's a very brief introduction. By the way, there's directions now for the introduction. There's directions not just in the script, but also directions in the notes of the PowerPoint slides, so you don't miss anything. So for example, here's some information. If you're going to implement it in person, you hand out, it tells you what to do here, which is, by the way, you have an opportunity before you even launch your first slide and launch your program. You have an opportunity to stop and think, do you and your organization want to implement the pre and post test, which will allow you to evaluate your program with your youth? So you've got 2 options here. If you're implementing this in person, you could simply hand out the pre-test, which is a scannable form. And if you're implementing this online, you could literally show your online link version, a SurveyMonkey version of the pre-test, have your youth click on it right now and complete it before you launch your lesson. So you've got it covered, whether you're implementing this in person or online. You've got a pre-test and a post-test. They're optional, but they're great, great tools to help you promote and improve your program. And they are in a scannable form or in an online form. So you have a lot of flexibility and ease for conducting your pre and post test. So that's in your parentheses there. That's directions for you as the teacher, the instructor, the implementer. And then it says show slide, and then you read your introduction. Welcome to Prevention Plus Wellness. I'm going to talk to you about things that you can do to look better and feel better based on your current wellness habits. So that's what you do. You present your script, a lot of enthusiasm, a lot of passion, looking in the eyes of your youth or the camera in this case, if you're implementing it online. And then you go into the screening survey. Now, again, here's some directions for you. If you're in person, you're going to make copies of and implement the screening survey, the hard copy. If you're online, you can't give them a hard copy. So what you're going to do is you're going to show the slides and have your youth complete the screening survey on a blank sheet of paper. Okay, now take out your copy of the Wellness Behavior Screening Survey. This tool is designed to assess how your wellness level, and the accuracy is based on how honestly you answer. Don't put your name on this. We want it to be honest. So this is all about the youth. This is for the youth. The screening survey, they keep it. They can throw it away. They can do whatever they want with it. You're not going to collect it. It's just for their use to increase their awareness of their health habits. And then show slides. So you'll show the complete the wellness behavior screening survey slide that cues your youth as to what to do, reminds you as to what to do. And the following slides are the actual screening survey items that we just looked at. So they're on your slides. And as you show your slides, again, if you're in person, youth complete the screening survey on a hard copy of the slides that you've made in advance from your digital download, and you just handed it out. Or if they're online, if it's a virtual lesson, you just have them complete the screening survey questions on a blank sheet of paper. No problem. Then you're going to provide feedback. So you've got the screening survey done. Now feedback. So here it is. You're going to provide feedback on each of those behaviors in the screening survey, starting with moderate physical activity. Tells you, as the instructor, show the slide, gives you instructions. You want your youth to raise their hands if they've completed any kinds of, I'm sorry, let me just read it. Ask participants to answer to themselves. On most days of the week, you engage in moderate physical activity, 30 minutes, such as, so they've already answered it in the screening survey, and now you're going to provide feedback. Usually in a two-step process. Step one, you're going to highlight the benefits and particularly desired future positive images of youth engaged in that wellness behavior. So here it is. You show that slide. Keeping physically active is key to achieving fitness and maintaining a healthy lifestyle. Adolescents who engage in regular physical activity tend to feel energetic, sleep better, and look and feel more physically fit. So notice the benefits. A benefit like sleep better is mentioned, but also very, very powerful, evocative image terms like energetic and physically fit are used. Those cue or trigger unconscious images of youth, of themselves like that. And most youth, as well as adults, really like to or wish to be energetic and fit. And to the extent that they do, that's a value for them, and that increases motivation and desire, and you're going to give them an opportunity to set goals to move in that direction, to increase their fitness and their energy level. And so there's your script. You read your script to your youth. Then there's a discussion question. So these discussion questions are built in so that particularly when you implement this to a group of youth in person or online, you pause, you let youth think about their own lifestyle, which is so important. Remember, we wanted to bring it back to their particular situation, each individual youth, so it's customized to them. And then you can have a 1 or 2 or 3 people respond. So discussion question: what types of moderate physical activities do you or would you like to do more of? Pause, let them think about it, and now have 1 or 2 or 3 people respond. If you're in person, you could choose somebody. If you're online, you can have them respond by chat, for example. And then, so that's the benefits. That's the positive image and the benefits of that wellness behavior, moderate physical activity. Now, the second part of this messaging is how opioid use is a barrier, harms that wellness behavior and achieving those desired benefits and images. So here it is. Here's your script. Here's what you read to your youth. Meanwhile, non-medical opioid use interferes with creating a physically active lifestyle. Using opioids gets in the way of your fitness goals by causing drowsiness, mental fog, nausea, and constipation, etc. So all of it is in the slides for the visual learner. Positive images are seen there. See the illustration of the young, healthy, happy people. Always positive, always using appealing images, which are more powerful than negative images. And then you move on to a vigorous exercise, the second screening survey question. So that's how you implement the opioid or any PPW program. Follow the script, use your slides, use the script, the group script for 2 or more youth or young adults, the individual script for 1 youth. So you'll provide this feedback all the way down to the end. And at the end, and you go through all of the screening survey questions that were in the screening survey. Nutrition, I think sleep is next, sleep. After that, stress control. And then lastly, opioid use, non-medical opioid use. There may be a little bit more content here because you're addressing other risk factors known to influence opioid use. And so you're talking about how opioid use can cause life problems, how signs of opioid use, overdose, treating opioid use disorder. Some of this content was put in here because SAMHSA, the Substance Abuse Mental Health Services Administration, was saying this is what they wanted to see in their prevention and intervention programs. Opioid treatment and prevention work and recommendations for increasing wellness. Now, these are not just avoid non-medical opioid use, but get plenty of moderate and vigorous physical activity, eat plenty of high density foods, get plenty of sleep, control your daily stress, and then now let's complete a wellness plan contract. Okay, so you're done with the feedback. That's the second step. The third step now is the action phase of your intervention. You're going to walk them through a goal plan. What does the goal plan look like? Let's take a look at it. We'll go back up to section 3, I think it is. I'll give you a little peek of the goal plan. Here's the goal plan. You have the recommendation for all these all these wellness behaviors. Again, number 6, you want certainly to recommend, most importantly, to achieve all of your fitness goals, to avoid non-medical prescription and illegal opioid use, but also even other illegal drugs, daily tobacco use, heavy alcohol, etc. And number 1, get moderate physical activity, at least 30 minutes. Number 2, get vigorous physical activity, at least 20 minutes. Take steps to manage your stress, eat a variety of healthy, nutrient-dense foods, etc. And then you're going to have them set a goal about physical activity. It's the core of this program. It's the core of the images. It's the core of relaxation and health behaviors in general. So they're going to identify what kind of physical activity they're going to get more of or continue to get. And they're going to set a specific goal, measurable quantity and frequency of that goal. And then they can choose one other wellness behavior. Could be nutrient-dense food, stress management, sleep, or none because they're working on something else. They're going to identify it very concretely, measurable, specific quantity and frequency. They're going to sign it and date it. You're going to co-sign it and date it to increase motivation for change. Then, new to all of our programs, or most of our programs, we have a 7-day self-monitoring tool. So youth will be able to circle or check off every day for the next 7 days. Did they achieve a goal that day or no, or did they not have a goal set for that day? And at the end of the 7 days, they'll have a range of goals from 0 to 7. If they had 2 goals, 0 to 14, and they'll see quantitatively that they're moving forward. And then you'll have a very important congratulations, feedback, instruction for posting their goals, where to go from here, reset goals the following week, etc. Really, really good content. If you implement to 1 youth at a time, this is the most customized way, because you're going to provide feedback to that 1 youth in person or online, depending on how they answered each of their screening survey questions. So again, you can collect your pre-test and post-test, if you will, and then you're going to implement the screening survey. And then if they answered yes to that first screening survey question, they get regular moderate physical activity. You'll read the yes response. It's highlighted by green, good, go. And then you say, oh, I see that you engage in at least 30 minutes moderate physical activity most days a week. Congratulations. you're physically active. So that's how you respond. The slides are the same, whether you implement it in person, one-on-one, or in a group. So you could toggle back and forth. You can implement it to one youth at a time, general population youth, high-risk youth, it doesn't matter. And let's say this person said no, they don't get moderate physical activity very often, then you'll read the no response, red, warning, high risk, and and your feedback is, oh, I see you may not have been getting 30 minutes of moderate physical activity most days a week. This could prevent you from being physically fit. So notice the feedback is either positive or neutral, no negative feedback, because we don't want to tune anybody out from listening to our lesson. Excuse me. So that's the main difference between the individual and the group script. The individual script is tailored to that individual youth's responses on the screening survey. Any questions about that? Let me know if that's not clear. You can ask me about that in your chat option right now. Let's go past the scripts for implementation individually and in a group, because we've looked at that. We've looked at screening survey. We've looked at the goal plan. Now let's look at your evaluation tools. So you've got some great evaluation tools to assess your program fidelity and outcomes. The first evaluation tool is the pre-post survey, which you provide to your participating youth before the lesson and immediately after the lesson. If you implement it in person, you'll hand out these scannable forms. You'll have your youth complete it like any scannable form with a dark pencil or pen, and you collect it from each youth. And if you scan your pre-test and post-test and email us the PDF, we'll run a free analysis for you because we've got the software to do that. So you've got a pre-test. Now, because you're collecting your pre and post-test, or you might choose to collect your pre and post-test, right within that one period that you're implementing your program, notice there's no lag time. It's not a week later, a month later, a year later. There's no need to follow up with your youth. That's the advantage. So you can collect pre and post tests from all of your participating youth. And you can do this with this scannable form, or if you do it online, we can give you a customized link for your organization so that your youth can complete these questions online. So because you're collecting pre and post within a single setting, you can't assess actual behaviors like last 7 days or last 30 days. So what you're doing is you're collecting data on predictors of behavior. The first measure in the next year, how likely are you to, is considered a measure of behavioral intentions. Behavioral intentions are the most highly predictive measure assessment tool we have known to science that I'm aware of for assessing future behaviors. And so you'll assess not just opioid use, but alcohol, e-cigarettes, cigarettes, marijuana, and in addition, healthy habits, physical activity, nutrition, sleep, and stress control. The second measure is a measure of perceived harmfulness, susceptibility, or risk, very much predictive of future substance use behavior. Notice you're not just measuring opioids, but also e-cigarettes, marijuana, cigarettes, and alcohol. Post-test is exactly the same. There it is, except you have two very important open-ended items which help you collect qualitative data so you can use, in the words of the youth themselves, for question 3, what did they like the best? You could see how this program is impacting their self-esteem, goal setting, motivation, health behaviors. It'll make you feel great as a prevention specialist, and you'll be able to share those outcomes, those testimonials, if you will, with other youth, with parents, with your organization, with your community, with your funding agency. And question 4, what did they like least, will give you hints as to how you can improve your program in the future. Also included, instructor survey. This is completed by you as the instructor, and it's a self-assessment to make sure you implement your program with good presentation skills, like number 3. Your level of enthusiasm and passion, very important. Hopefully, it's on the high end of the scale toward a 4, and as you go along, you continue to practice and implement it. That's your goal. You want to get to the high end. And lastly, there's a fidelity checklist. All right, let me just show you your slides very quickly. just so you can see the slides themselves that come in your program. The slides, here they are. Notice that they have directions or notes that help you guide your presentation. So there's your slides. What are you going to do first? After your introduction, or maybe even before that, if you collect your pretest, after your introduction, then you're going to collect your screening survey. That's your first part of your intervention. There's the screening survey question. So if you implement this online, no problem. You could have your youth complete this on a blank sheet of paper, put in number 1, and then answer yes or no. Number 2, answer yes or no. And there's your screening survey questions. There's a restatement of the first screening survey question. Most days of the week, do you engage in moderate physical activity, at least 30 minutes? And then there's the benefits of moderate physical activity, including sleeping better, but also very evocative image terms like energetic and fit, smarter and confident. Here's your discussion questions, so you can pause and get some feedback and make sure it relates to each youth individually. And here's how non-medical opioid use interferes with moderate physical activity. And there's your slides. You're going to go through this whole thing all the way through your program. And then eventually you're going to get to completing a goal contract. If you're in person, you'll hand out your goal contracts. If you're doing this virtually, you simply follow the goal contract slides and have your youth complete this goal contract on a blank sheet of paper. We also have a goal contract online, so we can give you a link to have your youth complete the goal contract online this week and then even following weeks in the future. All right, if you want to learn more than that, what you do is you go to our website, preventionpluswellness.com. So you go to preventionpluswellness.com. Let me see if I could grab hold of that, and I'll show you just what I'm talking about here. So preventionpluswellness.com. Here it is. So I'm going to show you the website, brand new website, very beautiful, very fun to look at and to look through. But what you do here, and there's a great new introductory video I recommend all of you take a look at. It's about a minute long. But here in the left-hand corner is a little sandwich or hamburger or whatever. It's a menu. You click on it. And then under the menu, you'll find resources. If you click on that, there's a bunch of free resources for all prevention providers. So even if you're not using Prevention Plus Wellness programs, you'll see some resources to promote wellness behaviors and to prevent substance use behaviors under the heading of resources. On the right-hand side of your screen, you see the little message us. If you click that, you can post a note in there and it goes directly to us anytime you need to communicate with us. Right there in the right-hand column, message us. All right, I'm going to pause at this time and see if anybody has any questions. So I'm going to look at the Q&A. I'm going to look at the chat and see what kind of questions that people have. We've got another 9 minutes, so feel free to type in any question, anything that wasn't clear, anything that you want to share. And Nataki says, how are school districts engaged to promote importance of substance use disorder prevention during virtual learning? How are school districts engaged? My response to you is having webinars every week, having trainings every week, talking with people throughout the country and even abroad. It all depends really on the local school district. So the question for you is, what is your school district doing? What are they engaging? So what you can do with a Prevention Plus Wellness program, because of its flexibility, because of its brevity, because of its positiveness, from what I can tell, talking with prevention and health providers throughout the country, they're more likely to get a Prevention Plus Wellness program to youth during the pandemic, either in person or virtually, than they can, let's say, another evidence-based program that's multiple sessions. So hopefully that answered your question. Another question from that person is, what opportunities to check back after the session to see if participants adopted wellness plans And if they did they adhere? So good question. You have your pre and post test, so you'll have a good sense of to what extent you changed their behavioral intentions and perceived harmfulness. That's very important. Then we now have an online goal plan, and you could easily give that as an assignment for the second week and subsequent weeks. And we can give you a customized link to that so you can see if your youth are completing that each week because they type their name in and they set a goal. So that will give you some sense of whether, and then you can provide feedback. So you want to continue the self-regulation piece, the self-control piece. You want to teach your youth to continue to set weekly goals that are measurable and achievable. And you want to give them feedback and continue to develop those skills so someday they can learn over the next several weeks and months to shape their own behavior. So the self-regulation piece, the goal setting, learning to set goals, to monitor goals, and to achieve goals, very, very critical tool that you can teach them over the weeks to come if you have access to them. Great question. Barbara asks, or states, you stated that we'll be receiving a hard copy of this presentation. Is the presentation copyrighted? If it's not, could extra questions be added, such as gender, age, for data purposes? So just to clarify, Barbara, what everybody's going to be receiving who's registered today is a link to this recorded session. The program that I'm showing you is copyrighted. It's not for free, unfortunately. We do have free resources on our website, which I just showed you under our resources page. But if you have resources, if you have funds, and you wanted to purchase one of our Prevention Plus Wellness programs, including, for example, this opioid PPW program, it is available for purchase, and we have online training for that as well as an option. And part of the training, Barbara, is that we talk to you about how you can tailor your program. So if you're interested in adding questions to the screening survey, for example, we can discuss how you can do that and tailor the PowerPoint slide messages so that they're most relevant to your population. Okay, so all of that is covered in the training for our program. But no, unfortunately, you're not going to be receiving the slides to the program because these slides and the program itself are copyrighted, and we do offer them, because we've spent so many years developing them, we do have to offer them for a price. Let me go to the chat, and hopefully I answered that, Barbara, for you. If I didn't, if I'm not answering these well, please do re-ask the question for me in a little bit different way. Resiliency wellness pamphlet somebody wanted. How are school districts engaged and promote? I talked about that. I talked about opportunities to check back. We have a YouTube channel. Our staff creates videos. Youth can subscribe. Okay, that's good. So do we. I'm not sure what you mean by that, but Prevention Plus Wellness has a YouTube channel. So you can look at all of our previous recordings about our programs and a lot of other content related to integrated prevention plus wellness interventions, programs, strategies, campaigns for youth. So I'm not sure if that's what you're talking about or if you're talking about something that you all do at your organization. I think YouTube, I think having youth involved in creating positive videos is a wonderful strategy, by the way, wonderful prevention strategy. Okay, I don't think I see any other questions. Let's just wait another minute. We've got just 2 or 3 more minutes. So if you have a question, go ahead and ask it in the Q&A or the chat option, and I'm happy to answer that. Great training. By the way, I always like to end by saying God bless you guys for what you do. You're my heroes for making it, your prevention heroes, making a difference in the lives of youth and families throughout the country and world, You're awesome. You don't get the, you don't get the respect, the attention, the pay, or anything, but you truly are amazing people, and you're making a difference. Do know that with our tools, you can actually see the difference if you use your pre and post testing, but know that you're making a difference in the lives of young people, and I thank you for it, and thank you for the opportunity to help in any way that we can and offer you anything that we can. So do let us know what you need, what you want from us, and we're continually evolving and developing new materials. Some of them are free for those that don't have resources. Some of them that are more elaborate, like our programs, do have a charge to them. By the way, we had created a marijuana media campaign back in, I think, 2017. We continue, and then we shut it down. I'm not sure why we did that, but I think it needed to be updated. We continue to receive requests for it. So what we're doing, just to let you know, no, you're the first ones to hear this, we are updating our marijuana awareness campaign. It's going to include a whole bunch of resources, and you can take it and tailor it to your setting, and you can use what you want, not use what you want, but it can save individual professionals like yourselves and organizations a lot of time, rather than starting from scratch and starting to develop your own materials. So there'll be blogs and quizzes and PowerPoint slides and all kinds of stuff in this marijuana media campaign. So keep an eye out for what we are offering. Go to preventionpluswellness.com and enter your email address so you get email blasts about what we're developing. Let's see here. Thank you. Thank you. Thank you for that. I appreciate your thank yous. Let me see, I want to back up here and make sure I didn't miss anything. Help promote students in school. Great training. Thank you so much. Thank you for attending. How has PPW staff marketed your program to school districts throughout the country? Well, it's you. That's people like you. Take it and share it. And we do have on our website, to help you with that, under the heading of resources, we have something called, I think it's called the PPW, promoting your PPW program. And under that, we've got free brochures of all of our programs, really colorful, two-sided, three-panel brochures. We got a one-page fact sheet. So we got a lot of tools on our website that professionals and organizations that you belong to, like you across the country and world, use to promote us. So we can't do it all ourselves. We rely on sharing what we can with you, and then hope you go out and then continue to share in your region, state, and nation. So we do have the tools for you to do that. Take a look at our website again. Thank you so much for the clarity, insight, and work. My pleasure. Thank you. Excellent. My pleasure so much. It's my honor to do it. Great information program. I feel our youth prevention staff could utilize. Wonderful. If you have any questions, you could reach me in the right-hand corner here. Message us right out of our website at preventionpluswellness.com, or you could email me directly at info, I-N-F-O, at preventionpluswellness.com. That's info, I-N-F-O, at preventionpluswellness.com. All right, that does it for us. Thank you so much. Have a great afternoon, everyone. God bless you. Take care. Stay safe, stay healthy, and keep up the great work. And let us know if we can help in any way. Have a good afternoon, everybody. Bye-bye.